Hi, I'm Christine Stewart, the Executive Director with the Canadian Mental Health Association here in Central Alberta. COVID-19 has impacted our organization in so many ways. We, of course, locked our front doors temporarily to ensure that the general public isn't coming in, that staff aren't exposing the general public. So we've locked the front doors and sent staff to work from home initially. We just brought staff back into the building in late July to start working from here and to begin taking clients in one at a time for appointments. We still do have our doors locked to the public for drop-in, walk-in services, but most of our services have been easily accessed either online or over the phone. So our counseling services, she's accepting calls over the phone. Our systems navigator has been really able to help so many people over the phone, figuring out how to access CERB, figuring out some housing scenarios, all of that. Our education program has moved entirely online for now. They are just starting to try some group sessions with the social distancing in place with masks. We've got the sanitizer, all of those pieces. So the first couple of groups that we've done in person have gone very well, but we can only fit, I believe 6 is the maximum number of people in the room that we have while maintaining that social distancing. So it is a bit tricky, but it is doable for now with small numbers. And we do have the online option, so if people still don't want to come in person, they can access the program online. For drop-in services, some of the things that aren't actually our programs, but people stopping in to touch base in that. We have been answering the doorbell and directing people in that regard, because some people don't have a phone and they have been waiting for the doors to open. So Monica is just answering the doorbell at the front and either directing people where they need to be or finding out who they need to talk to, taking down information, that kind of thing. We have had some COVID-related calls for sure in terms of mostly, I would say, systems navigation and our counseling positions. So many people at the beginning of this not understanding the CERB guidelines, people whose jobs were shut down and they were struggling for income, for food, those types of resources. So we've had a lot of that, as well as the mental health aspect, that people are looking for supports. And for sure, the education program has developed some kind of COVID-specific mental health courses. They're kind of 1-hour segments that talk about some specific aspects of how you can help and improve your mental health during this very stressful time and ensure that you're not only looking after your physical health, but your mental health as well. So there has been a lot that we have changed, a lot that we've added to try and support people right now. And making sure our staff team is doing well. You know, we had people that were very, very stressed out about this COVID thing and people a little less concerned. But all of us have been hugely impacted by the changes in our environment, by the structures that are in place, you know, the social distancing, the isolation. It's hard on everyone. So making sure that our whole team is mentally healthy as well, and that we're respecting their needs during this time has been really important to make sure that we can provide service to others. You have to make sure you're looking after yourself as well. Yeah, CMHA, we're just here to help as best as we can. We do not, of course, provide every service, but we pride ourselves on having the ability, if people call, we will provide support. And if we don't offer that service, we're going to do our best to get you connected to who does. But there aren't too many things we can't at least help with short term to help stabilize, get you situated, and then figure out what the best long-term support for you would be. So please reach out. We have peers that work in our education program that have lived experience, have been through basically anything you can imagine. They can relate and offer some guidance and some support. Our education program has hands-on tools that will really give you some direction, like not just, you know, have a better day, but some specific, you know, whether it's deep breathing or journaling or some actual things that you can do to help yourself. They're there to share those tips and techniques. And then we have our crisis counselor, and then we have Sharon, who can help navigate some of this, some of the information that's out there that's hard to make sense of. She can do her best to guide and support you. So yeah, reach out. We're at 403-342-2266, and we will do our best to help. Thanks so much, and take care.